Hello everyone, welcome to PAINFrame. If you don't already, follow us at stanmatthewmd.com. There's a lot of things we want to talk about today. The first thing I want to tell you is what is the goal of this program? It's to help as many patients as possible that are suffering with chronic pain. There's a couple things we want to talk about today. One is the coronavirus. As you know, a lot of people are worried. There's a lot of concerns, a lot of misinformation. I want to give you and your family some updates on that. First, I want to tell you a little bit about who we are and who I am. My name is Dr. Stan Mathew. I'm a rehab doctor. I'm board certified in rehabilitation medicine as well as in pain medicine. I moved to the great state of Iowa about 10 years ago, and it's been my honor to practice here. And again, the goal of today and our program is just to get as many people aware of some of the new modalities and options they have for treatment. Well, everybody, thanks for being here. Before I go any further, I want to introduce a wonderful, wonderful nurse practitioner, Staci Becker. She has been such an asset to my business, our medical practice, and healthcare in general. She's a wonderful wife, mother, daughter, and just an overall great human being. I'm going to let our host Staci take it from here.
Well, thank you, Dr. Mathew. Glad to be here. Now, for our viewers and those who don't know, tell me a little bit about the origin of your pain practice and how you got started in pain medicine.
Absolutely, absolutely. When I was in training in medical school, there was a doc who took a lot of interest in me. This physician kind of took me under his wing and showed me the ways of pain management and how patients were underserved. He then introduced me to the world of physiatry, or physical medicine and rehabilitation. It's an interesting specialty. There's not a lot of us out there. About 7,000 in the whole United States. There's about 40,000 cardiologists or heart doctors. We're kind of specialists over nerve, bone, and muscle. And my own practice really went deep into the world of chronic pain, which I'm also board certified in.
So you practice in Cedar Rapids, Iowa. And
I do.
Yes, and how long have you been doing that?
So I've been practicing here for 10 years. Initially a native New Yorker, did all my training out there, born and raised, and then moved to the beautiful state of Iowa, where we practice actually at St. Luke's Hospital. We're on the 5th floor.
Awesome. So describe an average day in your clinic.
Okay.
What common conditions do you treat? And
Sure.
patients?
A lot of different types of conditions: chronic neck, back pain, hip pain, fibromyalgia, headaches, nerve issues, and weakness. There's a wide array, but what I want you to know is if you've been hurting for more than 2 or 3 months and are not getting good answers, please give us a call. We'd love to help you.
So would you say one of your goals for your patients is to have them leave your clinic with same-day pain relief?
100%, Stacy. One of our main goals is not letting the patient leave the same way they came in. I feel it's a disservice. We try to follow this trend, and we have about an 80% success rate. Patients who leave our visit after the first visit feeling better. We do this through a lot of different procedures, injections, medications that we can get into. But again, coming to see us, we don't want you to leave the same way you came in.
Can you describe some of those services that you offer?
Thanks for asking, Stacy. We do a lot of different procedures, things like trigger point injections, Botox injections, hyaluronic acid injections, dry needling. We heavily use things like aquatic therapy, pain psychology, manipulation. These are a lot of big words, and what I want you to take away is we use injections, medications, and procedures when appropriate for appropriate diagnosis to get our patients feeling better.
So it sounds like you use a patient-centered approach. Do you also have a team that you work with? And can you speak a little bit more about that?
Love to. I have a wonderful team. You're speaking to one of them now, our wonderful host, Staci. We have a group of wonderful nurse practitioners that have made it their career, specialized in the treatment of non-surgical spine, orthopedics, and chronic pain. Not only are they good providers, but they care, which I feel is the biggest thing that you can bring to a patient interaction. We also have an awesome team of therapists, physical and occupational therapists. We have a group of rehab nurses that have been in the specialty for a while, and last but not least, an awesome medical psychology team. We're big believers in mindset and body going hand in hand, that if we don't get your mind thinking correctly, it's hard for your body to follow. We're blessed at St. Luke's to have a great team of medical psychologists.
So for our viewers, if you or yourself have pain or your loved one have pain, it might be benefits to you to check out Dr. Mathew's website or Facebook profile. Do you have those? Are you on social media?
We are, Staci. About a year ago, I made a really big attempt to get a lot of free content out to our patients. The doctor visit, the provider visit can only be so long, 20 minutes, 30 minutes. It's not enough to talk about all the things we'd like to discuss. Please follow us. Check out StanMathewMD.com. Follow us on every social media profile, Facebook, Twitter, Instagram, whatever you're into, YouTube. We want to get you tons of free content and data to try to help you with your chronic pain.
Thank you. All right, Dr. Mathew, should we talk about the hot topic, coronavirus or COVID-19? You want to tell me a little bit about it?
Absolutely, Staci, absolutely. First off, I want to say anyone who is suffering, patient-wise, and family and friends, our thoughts and prayers are with you. It's scary. We're learning a lot, and new science and data is coming out all the time. Just a few days ago, the World Health Organization labeled this a pandemic. That's a big word, and I just want to help you understand what that means. An epidemic is typically something that is local, defined to a city, state, or country. A pandemic is when a disease or crisis has gone global. By definition, this is a pandemic because it's in numerous countries around the world. As most of you know, it began in China, is what the most recent data says, and then spread to a few other countries, and unfortunately is now here in the United States.
So the number of confirmed cases in Iowa has increased. What's the number one thing people or viewers can do to help prevent the disease transmission or the spread of this virus?
Great question, Staci. A few things I would tell you guys to do at home is first be calm, be helpful, and be smart. It's common sense, most of these things. But when somebody has a cold at work, you try not to go out there, give them a hug, shake their hand. It's probably not good to have a meal with somebody who's actively sneezing. Basic, simple things. If you do have a cough and cold, cover your mouth. Wash your hands frequently. Now, there's two groups of people we talk about. Providers like yourself, Staci, who are at high risk because you care for people every day in the hospital and in the office and in other settings. And then there's the regular population. The regular population, my opinion, and this is just an opinion, will be okay. If there is someone who is at higher risk, or if there's a group that's at higher risk, it is generally the elderly, those with a lot of medical comorbidities, things like high blood pressure, diabetes. They should be more careful. It's probably smart not to go to any big events right now just because you're not sure if you're elderly and sick, if you catch this, how you're going to do.
So, Dr. Mathew, are you doomsday prepping?
Great question, Staci. I am not. I'm a perpetual optimist. I see the glass half full. I'm hoping that in the next week or two we're going to hear a lot of great news. A little bit that I heard so far is that things are getting better in China, but I wouldn't be mad at you for stocking up on Oreos, Skittles, and
toilet paper.
And toilet paper.
Yes. Well, more to come on that then. All right.
Well, everyone, thanks for joining us this week for PAINFrame. Our goals are to get as much content in the world of chronic pain to help as many people as possible. Social media family, please tune along. Look forward to for more episodes that we're going to be bringing with tons of healthcare-related topics. Be great. God bless. Wish you all the best. If there's anything we can do to help, follow us at StanMathewMD.com. Bye now.